Hi, everyone. I'm Max Pritchard, a senior at the University of Minnesota, Twin Cities. If you're a subscriber, I apologize for the lack of regular uploads this academic year, but as it so happens, the reason for this scarcity in videos has to do with the topic of this video. My mental health has been pretty terrible this year, and sadly and infuriatingly, that's a trend I've noticed with many classmates and friends. This academic environment seems to encourage, produce, worsen mental health difficulties. Fortunately, there is help available. The university does provide many mental health resources. Unfortunately, these resources can be difficult to find and hard to navigate. I hope this video can provide some clarity. Part 1. Crisis Counseling Options. If you are suffering from a mental health crisis and need to talk with someone urgently, call the 24-hour crisis hotline at 612-301-4673. For an in-person option, Boynton Health's Urgent Mental Health Care Clinic is available at 410 Church Street Southeast, 4th floor, from 8 a.m. to 4 p.m. on weekdays. The Aurora Center provides free and confidential crisis intervention to victims of sexual assault, relationship violence, stalking, and harassment. Their sexual assault 24-hour helpline can be reached at 612-626-9111, and their office can be reached at 612-626-2929. The university also recommends off-campus resources. The Suicide Prevention Hotline is available 24/7 at 800-273-8255. Fairview Hospital provides emergency care, assessment, and referrals for people in a behavior crisis due to mental health or substance abuse. The center is located on the Riverside campus of University of Minnesota Medical Center and can be contacted by calling 612-672-6600. Hennepin County Acute Psychiatric Services provides emotional crisis counseling, assessment, and referral 24/7, and its phone number is 612-873-3161. People of color who prefer text crisis counseling can use the Steve Fund Crisis text line by texting STEVE, that's STEVE in all capital letters, to 741-741. And, as will be the case for all of this video's services, if there is an emergency situation of imminent risk of physical harm, call 911. Part 2. Student Counseling Services. Individual counseling is available to students as long as they are in Minnesota during the sessions. Student Counseling Services provides therapy for personal issues, academic counseling, and career counseling. This is a non-crisis service that can, as far as I gather from my experience and the word of others, take a while to connect students with a counselor. This can especially be the case if you're suffering from something, such as OCD, that Student Counseling Services does not specialize in which case you will be referred to an external community provider. While the system can take time to navigate, I strongly recommend it if you are even slightly suspicious that you may need counseling. You do not have to be at rock bottom to get help. If you're feeling anxious, depressed, if you need someone to talk to, and this sounds at all appealing to you, I'd recommend at least looking into this resource. After signing up for counseling, you'll complete a 30-minute mental health screening with a counselor, which will lead to you being recommended resources and connected with next steps. These intake sessions can be a little awkward, but I find it sort of reassuring to first talk through how I'm doing with someone who I will not have to interact with again. In my experience, you don't have to go into too much depth, and there isn't the stress of having to start to build a patient-counselor relationship. Frustratingly, pricing for these sessions is quite vague. The website doesn't specify an estimate for session costs, and I emailed their helpline for more information about this a full 3 weeks ago and haven't heard back. I believe that the first 10 sessions of individual student counseling are free for all U of M students, but I can't be positive that that system is still in place. If finances are a concern, please press for more information when you complete your intake session. Student Counseling Services also connects students with the Learn to Live program. Learn to Live is a massive online mental health care provider that hosts digital cognitive behavioral therapy programs. The 7 available programs are Social Anxiety Program, Depression Program, Insomnia Program, Substance Use Program, Stress, Anxiety, and Worry Program, Panic Program, and the Resilience Program. There's also the Let's Talk program, which emphasizes that it is not mental health treatment, but rather is an informal, confidential, one-time consultation. These can be useful if you're not sure about counseling and want to see what it would be like, or if you want perspective on a specific problem or single issue. If you are looking for community in your mental health care journey, Student Counseling Services provides educational workshops, affinity groups, and workshop groups. Educational workshops cover topics such as academic stress, sex ed, and anxiety. Affinity spaces provide supportive environments for students of specific identity groups. Examples include the Black, African American, African Meeting Space, and Chronic Condition/Chronic Pain Connection Space. There are currently 3 counseling groups, one group for dissertation and thesis support, a grief support group for those who have lost parents or siblings, and an understanding self and others group. Students can join counseling groups by calling 612-624-3323, emailing counseling@umn.edu, or talking to their Student Counseling Services counselor. Lastly, there are academic success resources, both academic success courses that help students improve academic skills and one-on-one academic success coaching. Many colleges, programs, and departments also offer their own tutoring services that will help more with specific classes. To learn more about these, I recommend talking to your instructors or advisors. Part 3. Supporting fellow students. If you notice a peer is not doing well and is not getting the support they need, consider submitting a referral through the UMN CARE team. CARE offers brief, non-clinical case management to students who are stressed or in a crisis. If a student is expressing a physical or mental health concern, lacking basic needs, or expressing threatening behavior towards themselves or others, this is a program specifically designed to get the help they need. To submit a referral, simply fill out a brief form on the CARE website. The program is funded by student service fees and is therefore free of charge. As with other resources in this video, this resource is not designed for situations with imminent risk of life-threatening harm. Part 4. Well-being resources. If you're not looking for counseling or crisis options, the university also provides many general well-being resources that can have a positive impact on your mental health. The Recreation and Wellness Center offers plenty of recreational activity options, along with well-being specific services such as massage therapy and physical therapy. They also host the popular PAWS program, Pet Away Worry and Stress, which features all sorts of registered therapy animals. The service is available on each campus at least once per week during spring and fall semester. Maintaining a healthy diet and eating consistently are good ways to support your mental health. Unfortunately, grocery access at the university is badly lacking. I have a video focused entirely on food resources that you can find up here in the description or by visiting my channel. The Earl E. Bakken Center for Spirituality and Healing is a center located within the School of Nursing that provides students with health and well-being education. The center offers mindfulness programs, free webinars, and well-being workshops, with topics ranging from mindfulness-based stress reduction to therapeutic yoga. The Gender and Sexuality Center for Queer and Trans Life provides programs and resources for LGBTQIA+ students, employees, alums, and allies at the University of Minnesota Twin Cities. Programs include Tongues United, which provides a space for queer Indigenous people and people of color, and the Queer Pride Mentorship Program. Resources include large documents with on- and off-campus LGBTQIA+ resources, along with a page linking to health resources. Parents as Students Support Group is a weekly meeting for undergraduate students who are parents to connect, develop support networks, and build community. Lastly, Be Well is a resource created by health sciences students, staff, and faculty. Their services include health coaching, well-being workshops and panels, and social events. I've tried to make this list fairly comprehensive, but I'm sure there are services that I've missed. If you need further resources, consider talking to your dorm floor's community advisor or your academic advisor. As always, please comment with any questions, corrections, or additional resources. Thank you very much for watching, and please be kind to yourself.